Hello everyone, we have with us Prof. Cheng Ching Yu. He is a senior clinician scientist at Singapore National Eye Centre. He is also the head of Ocular Epidemiology Group at Singapore Eye Research Centre and also the head of the Data Research Platform. Welcome with us, Dr. Prof. Cheng Yu. Can you explain more about the objective of your recent study, which was published in Nature Aging paper?
Yes, thank you for having me here. And in the past few years, like my group of data science at SERI, we have been working on using AI technologies to detect ocular disease and systemic condition based on retinal photos. And this project is one of the model we have trained so far. So essentially, we use the deep learning to detect visually significant cataract based on retinal photos. And for cataract patient can have early cataract, mild cataract, and severe cataract. The group of patients want to detect by using this AI model is those whose vision is poor, affecting their quality of life and visual functions. And it's important to detect them from the community so we can recommend referral to eye doctor for further interventions.
So it's very interesting. You're saying that with this deep learning system, we will be able to detect visually significant cataract at a community primary care level. So how do you think this can improve from the existing way of diagnosing cataract?
Yes, the main deployment intent of this AI model is on the detection of visually significant cataract, as you mentioned, at the community level. So you know that a retinal camera is already available in many diabetic retinopathy screening programs in Singapore and other countries. And we can also use the same platform to detect visually significant cataract based on retinal photo without any other machine and facilities. So I think, by just, in addition to screening for diabetic retinopathy, this is also a very good opportunity to detect cataract. As you know that the cataract is the leading cause of blindness, no matter in Singapore or in the rest of the world.
So how does this compare with the evaluation by an ophthalmologist in a face-to-face setting?
Yes, in our study, we compare the performance of these AI models versus ophthalmologist performance. In this assessment, we include 4 ophthalmologists. They had a clinical experience ranging from 2 to 8 years. But in our evaluation, we found that this AI model's performance in detecting visually significant cataract is consistently performed better than ophthalmologists.
Okay. So you have measured the sensitivity as well as specificity, right? Can you explain more about it? Like how is it better in terms of sensitivity and specificity?
I think it may be easier to understand the error rate. In our AI model, the error rate is less than 4%. But if you compare to the graders in our reading center or ophthalmologists, their error rate about some of them are more than 30%. So you can see that the AI performance is much better than the human grader and the eye doctors.
So that's excellent. So you are saying that is it ready for real-world application?
You know that in the research setting, it's very different from the real-world setting. So basically, our next step is to conduct a clinical trial in our communities to evaluate the performance of this AI model in a real-world setting, including its effectiveness and feasibilities. So before, only after that, we are able to deploy that in the communities.
Okay. Is there any limitation to the study which you performed? Like, is there something more you want to learn in the present study?
In our model, basically the algorithm was trained from diabetes and non-diabetes populations. But if you want to do this together in our diabetic retinopathy screening program, we have to do some fine tunes on our model to be suitable to apply that in a diabetic populations. So this is also something we want to improve on in the next stage.
Well, I hope that soon we have this real-world application of this deep learning system at the community care level so that it benefits our public. Thanks once again, Prof. Chengyu. Thank you so much.
Thank you.
Thanks.